I will, to the best of my abilities, preserve, protect, and defend the bylaw of the association, and devote myself to the service and well-being of our members. I will discharge my duties with fairness and without fear, favor, affection, or ill will. I solemnly make this pledge upon my honor. So help me God. Please appreciate it.
Association of Resident Doctors ARD of Delta State University Teaching Hospital Oghara has held their 14th Annual General and Scientific Conference AGM. The conference was held on Saturday, the 7th of December 2024 at Main Auditorium, DELSUTH Oghara, and the dinner night at Dallas Grand Beach in Oghara, Delta State. The conference is held every year, making this year the 14th celebration where new executive members were sworn an award given to deserving resident doctors of DELSUTH. Past executive of the association encouraging newly inaugurated ESCO to put the association first and be dedicated and diligent in carrying out their duties.
Alright, my name is Imonioro Emoife. Thankfully, I was able to serve as the treasurer of the association for 1 year, and during this period we were able to do some good work. My advice to them is first, the focal point of their duty should be the association. So if the association is their drive, the decision they are making will be for the good of the members of the association and not for personal gain. So the reason why they are there, they should always remember that the association comes first before any other issues we think. So that's my own advice to them.
I'm the vice president of ARD DELSUTH, and ARD DELSUTH, we have had a lot of stressful conditions in this year. However, we are thankful to God for everything He has done for us. And my message is that they should work hard, they should cooperate with one another, and then they should collaborate with other organizations, non-governmental organizations outside DELSUTH, for them to have impact of what is happening within DELSUTH, outside DELSUTH.
Dr. Iriri Clinton Umukuru of the Department of Anesthesia. I'm the outgoing PRO of the association and the incoming welfare secretary of the association. It's been a wonderful year. We've done our bit to serve the association very well. We've not been able to achieve everything we set out to achieve. It's a continuous process, and I'm a part of the incoming ESCO. We do hope that we will be able to achieve the things that we've not been able to achieve. And I'm going to work with the president and other members of the ESCO. Of course, the president has his own objectives for the association. We'll work with him. And for the government, well, the government has done its bit, tried to do one or two things for us. But there is a lot to be done. There's still a lot to be done. So we are saying that I personally appealing to the government to look inwards at DELSUTH. There is more than enough to be done.
Dr. Oghara Itatafia, the newly inaugurated vice president, in an interview with Rero TV correspondent Wewele Faith, through some highlights of what the people and doctors are expecting in this new administration.
Dr. Oghara, I'm the vice president-elect of the Association of Resident Doctors, Delta State University Teaching Hospital Oghara. With this new administration, we hope to push the cause of the citizens of Delta through the equipment of the hospital. We also hope to push the welfare of doctors, then the accreditation of department. We thank Right Honorable Elder Sheriff Oboriwori for the good work he has started in the hospital, and we know that he is going to do more for us, and he has the interests of doctors in mind, also with the Commissioner of Health. Thank you.
Speaking to Dr. Ogenetiga Ejeri, the newly inaugurated president, in his interview, appreciated the Delta State government and the governor, Right Honorable Eda Sheriff Oborowori, for his contribution and efforts he has made to keep the hospital running, and also made an appeal to the government for them to look into the infrastructure and equipment that are lacking in the hospital and provide the necessary needs of the hospital to keep it running for a conducive working environment for doctors. He also encouraged doctors to unite and work together to give a better health care to people of Oghara and the society at large.
Dr. Ogenetiga Ejeri, I work in general surgery department in DELSUTH, and we are coming in as a new executive council in the Association of Resident Doctors, DELSUTH. The expectations are very simple. The hospital right now, thank God the government has been working hard to make sure the hospital is more efficient and delivers the kind of quality of health care to Deltans that they deserve. And we are only here as Association of Resident Doctors to see how we can shed light on those issues that are yet to be tackled as far as delivering the kind of health care that Deltans need, in terms of the welfare of doctors, in terms of training, so that we can have our doctors offer world standard of health care. So those are the things that the association focuses on, and those are the things that we would put more emphasis on this year to go a step further than where we have been so far. We are grateful for the buildings that have been started up in the quarters to help house resident doctors and house officers reduce the amount of risk that they face traveling long distances coming to work, and make them more accessible so that when Delta people need healthcare, they are available to offer. They don't have to come from far. So that has been a good thing, though it's been taking time. It's getting close to 2 years already, and those buildings are not yet ready. What do we hope that the government would focus on? What we want them to focus on the issue of the hospital. There are certain things that are not the way they ought to be. For example, as far as manpower is concerned, most departments in the hospital have a number of doctors that have been accredited by the colleges that are training us that those doctors should be there to run those departments. But most departments have half the number that's recommended, meaning that the patients can't get the full attention that they need because few doctors have to attend to many patients and people have to wait. We need employment, massive employment, to fill in these gaps in the hospital. Cost of power in the hospital has skyrocketed, and the hospital now has to ration electricity such that sometimes ACs are cut off, some areas of the hospital are cut off, and then the patients don't have the kind of comfort that they need. Doctors who are taking care of these patients, the doctors who are taking care of these patients have to live, work in very hostile environments without ACs, in heat and in darkness. So those are some of the things. Even water. Sometimes the wards have water cut off such that the patients don't have enough water to flush their toilet, and some other details like that that I will not want to go into. Then, if we want to talk about the various departments, for instance, radiology has the issue of the CT scan, the MRI, the mammography machine. These machines are very important because we need them to make a diagnosis, especially for patients that are very, very ill. Some of these patients are too ill that you want to just make a diagnosis and quickly take over the treatment that they need. But some of them have to now travel all the way to Warri for the treatment, and we're risking their lives. Someone with stroke, for instance, with a massive stroke, has no business being on the road. Someone who has severe head injury has no business being on the road. Mammography is just a test on the breast to know whether there's breast cancer, but we have had patients go to Warri for breast cancer and have accidents with serious injury that nearly took their lives. So these are issues we need to look into. We also have the issues of some of the other, the laboratory, where the lab that runs many of the tests, some of the machines they need are not functioning properly. the microscope, for instance, sometimes they are not able to make a good diagnosis with the microscope, that they have to send some of these specimens all the way to other states, as far as Ile-Ife, to get a diagnosis. And I think that Delta State deserves better than that. Then when we talk about the pharmacy, sometimes the drugs are in short supply. The drugs sometimes late in the middle of the night, when we want to treat our patients, we realize that a very important drug or important item that we need is not available, and by that time it's usually too late to go and look for those things in pharmacies outside. Some of them, even in the daytime, you have to travel out of Oghara to get them. So in a center like Oghara, like Delta State University Teaching Hospital Oghara, we need these things to work well. The various departments now that have the different doctors who work also have difficulties that make it hard for these doctors to deliver their services. For example, in the ophthalmology department, there is a particular equipment called the optical coherence tomography. That machine is supposed to be used to treat people with glaucoma, people who have the pressure in their eye getting higher than it's supposed to be, and it can lead to blindness. But we send all of them out of the state for treatment, to Edo State, for instance, and this is not really easy on Delta people. They are unable to cope. The dental area has issues with dental chairs. Normally we should have up to 15 dental chairs, but we have just 6, and as a result of that, we can't get accreditation. We cannot get the permission to do certain kinds of treatments within the hospital. The number of there is a need for orthodontists that will help in this accreditation of that department. We don't have that. Then if you want to still go to other departments, for example, in the theater, we have 6 operating suites for surgeries in the hospital. Only 3 are working. These 3 that are working can hardly work 3 of them at the same time, because we have to take one equipment or one item or the other from one theater to the other, so that these 3, 1 or 2 of them can work at a time, but hardly all of them. And what that results in is that somebody who has an emergency has to join a queue, a long queue, waiting. Sometimes somebody who needs surgery today ends up being operated 2 days later, because the pace of work is very, very low. Then for elective cases, cases that you plan, they are not emergencies. You want a situation where if you come to the hospital, within 1 or 2 months, you have your surgery done, but the hospital will give you a date that is as far as July, for instance, July next year. Not because people cannot do the operation, but because the theaters are all occupied, they are all booked, and they are too few. So we need to look into that aspect, make sure all the equipment, the operating tables, the anesthetic machines are working properly. There's the issue of the intensive care unit. Intensive care unit is a place where patients who are very, very, very sick and cannot be put in a normal ward have to be nursed. In the ICU, you ought to have 1 nurse to a patient, and you ought to have ventilators for all the beds. 6 beds there, we have only 1 ventilator available. The ventilator is suboptimal. It's not working as it ought to. Also in that place, we're supposed to have an arterial blood gas machine. That machine runs some blood tests to tell you whether you are doing well taking care of the patient on ventilator or not. And most of the time, and that machine has not worked for several years, meaning that the kind of care that we ought to give people in the intensive care unit, we cannot give them that care. The ICU for small children who are less than 1 month, called the neonatal ICU, also has issues with equipment, most especially the issue of ventilators. We need ventilators there. The one that is there is being shared with the neonatal ICU and the theater, and we need that to also be addressed. Then the other issues include the issue of the dialysis center. The dialysis center is supposed to have the dialysis machines are not all working. And then there's also the complaint that patients can't afford the dialysis, so some of them miss their sessions, and it's something that we hope would change. Then there is what we call endoscopy. Endoscopy has to do with putting a camera through vital organs without injuring the patient, so you can see what's going on within the body. DELSUTH was the master of that. The machines are not working anymore. We cannot do upper gastrointestinal or endoscopy or colonoscopies at the moment, and we send our patients far away to do these investigations. Laparoscopic or minimally invasive surgery. Sometimes some kinds of some patients that need surgery, we don't have to open them up and make a very big wound to treat. With a small wound and tiny holes in the body where you put cameras and some other equipment in, you can do the surgery and the patient goes home in a shorter time, spends less time and gets strong, healthy fast after the surgery. DELSUTH used to be good with all that, but our laparoscopy is nowhere to be. It is not functional at the moment, and it's something that is very important. That's where the world has gone. DELSUTH has been ahead of most hospitals in the world when it comes to this, but now we are nowhere near even some small private hospitals when it comes to laparoscopic or minimally invasive surgeries. And it's something that we hope that within the next 1 year it will be addressed. There's a building called the 80-bed facility that right now is housing some of the units, like the children emergency room and housing the ear, nose and throat and all that. That building right now is underused and is becoming a dilapidated building in certain areas because the quality of work done there and the kind of maintenance it needs have been defective. So it's something that we need to look into. Another issue is the issue of the orthopedic and trauma center. It's a building that has been completed but is yet to be equipped, yet to be furnished. We are hoping that very soon the government would look into that so that we can give the best kind of treatment. We need certain equipment for certain departments. For example, the plastic surgeons would need a dermatome, a mesher, they would need liposuction machine and several other equipment that are needed. We need another ultrasound for urology. And then hopefully the issue, we hope that all these issues will be addressed very, very soon so that we can give quality health care to Delta citizens and Delta occupants, inhabitants. Now, we are grateful for the revised CONMES, which has been an upward revision in the salaries, but we have several months arrears that are yet to be paid. They have been promised, and we are grateful that that promise has been made. So we hope that that promise is kept very, very soon, alongside other allowances that have been promised to us. Because even with all this revision in salaries and all the new changes that have been made, the Nigerian doctor still falls short in terms of his ability to purchase compared to doctors in other African countries. Some doctors in other African countries, you convert their salary to dollars, it's above $2,000. But most of us are below 500. So by the time you talk about the courses we need to participate in, the things we need to learn, how we need to increase our skills so we can offer more quality to our patients. We have issues. We are unable to offer that because the money it takes to train us is even defective. Our salaries are just barely enough to just get by and cope with the issue of transportation before you talk about further training and so on and so forth. So since there have been promises in those areas, we look forward and we are very grateful to the government, to the Honorable Commissioner of Health, Dr. Joseph Onojaime, to the Governor, His Excellency, Elder Sheriff Oborewori. We are grateful for all this and we look forward to a beautiful year ahead, that in the next few months, many of these issues will be addressed.
My name is Rero Henry Akbos, and this is Rero TV. Thank you for watching.